Hello and welcome to Congressman Joe Courtney's telephone town hall. Thank you to the thousands of residents from across Connecticut's 2nd Congressional District for joining us this evening. My name is Ryan and I will be your moderator. If you would like to ask Congressman Courtney a question at any point during the call, please hit *3 and you will be transferred to a staff member who will add you to the question queue. You will then rejoin the town hall and I will call on as many of you as possible within the hour. To get to as many questions as possible, please keep your questions brief and direct. Again, please press *3 now or at any time this evening to ask a question. With that, Congressman Courtney, over to you.
Great. Well, thank you, Ryan, and thank you to everyone who has already joined on, and I know we're probably going to have a sizable group. Obviously, people are bursting with questions, legitimately so, in terms of just the impasse that exists in Washington. It's been 18 days since the House of Representatives has last met. On that day, the House passed by a very small margin a short-term continuing resolution that was, again, an effort to try and address the issue of the looming shutdown. As you know, I think we'll hear tonight as I sort of walk through what was missing from that bill, particularly having a continuing commitment to a program that's been on the books for 5 years in terms of helping particularly middle-class people afford health insurance. That is the primary sticking point in terms of getting, a true clean CR passed and then allowing the regular budget process to be negotiated and worked out between the two sides in a very closely divided Congress. So again, I'm going to stop there and, we'll just go right into questions because we want to get as many opportunities for people to ask questions during the hour that you're here. Obviously, there's going to be opportunities for people to follow up with voicemails and emails if there's questions that, again, we don't get to tonight. But again, I'll try to be as concise as possible so we'll obviously get a chance to talk to as many people as we possibly can. So I will stop there, Ryan, and let's open up the switchboard.
Thank you, Congressman. A reminder, if you would like to ask a question at any time, please press *3. First up, we have Jared calling in from Willimantic. Jared, you're on the line with Congressman Courtney.
Hi, Congressman. I know a lot of federal employees are not getting paid during the shutdown. Are you and the rest of Congress still getting paychecks?
So thank you for asking that question. You're right. Starting on October 1, the pay period, which began running from that date, and the first payment date is October 15th for federal employees, all across the board, including our military. If this issue is not settled by then and the government fully reopened, then people will not be paid on that pay period. On October 1st, I sent a letter to the payroll department for members of Congress instructing them to withhold my pay starting October 1 that accumulates on that date and until, just like every other federal employee, the system is switched back on and payroll system resumes. Again, I don't think members of Congress should get paid during the time of a shutdown. The Constitution prohibits a suspension of pay during a term of Congress. There's historical reasons why that has been on the books for so long. However, members do have the legal ability to switch off their paychecks, which is what I exercised and I did. And we received confirmation from the payroll department that that suspension of pay is in effect, just like it is for any other federal employee that's in the system. I appreciate you asking that question. It's obviously something that's very much on people's minds. But, again, I think, we should be in Congress really working as hard as we can to get to a fair and equitable and comprehensive resolution to this impasse. And again, I think the the pieces to that solution definitely exist. It just takes, I think some goodwill and real negotiation to get to that point. And so I'll stop there.
Thank you for your question, Jared. Next up, we have Christine calling in from Coventry. Christine, you're on there with Congressman Courtney.
Hello. Hi, Congressman Courtney. Thank you for taking my question tonight. Just a little background. My husband and I currently purchased our health insurance on the exchange. And without the premium tax credits, our premium would be about $2,700 a month. Our actual cost is far south of that. And with that said, I heard there was an increase approved for healthcare insurers to go up about 16%. So we're looking at over $3,100 a month or $37,000 a year. That is not only unaffordable, it's impossible for us. And I want to know, what is Congress doing to get that premium tax credit extended? And secondly, how will we be able to make a decision if the government is still shut down during open enrollment? And I applaud what you're doing to keep the government shut down, because I think that's our only leverage. So I get it. I'm just curious how we're going to be able to move forward. Thank you.
Before you jump off, can you, again, just share, if it's okay, what your monthly premium is today with the
$145.
Right. So you're going from $145 to $2,700 a month.
Oh, it's going to be over $3,100. It's going to be more than that.
That's
Yeah.
Right. Mention that.
I mean, that's based on the 16% increase that I get. Yep.
Again, thank you for sharing that information, because really, when you boil down, the impasse that exists right now, your story is really right at the center of it. There are 24 million Americans that receive their health insurance now through the exchange. 5 years ago, the premiums tax credits were boosted to make sure really that middle-class people, kind of like yourself and others who sort of fell off a cliff, in terms of the premium credits that were in place 5 years ago, could also get some relief so that they wouldn't get free insurance, but they would get affordable insurance. And again, I think, Christine, because we didn't get a chance to really get into the weeds of it, but there's also a deductible, and I'm sure it's probably pretty significant, particularly if it's a bronze plan.
Mm-hmm. It's several $1,000s. Mm-hmm.
Yes. So the out-of-pocket is significant, and some of the rhetoric that surrounds the discussion around this issue down in Washington talk about these programs as free health insurance. It's not. You pay into it, and the question is, though, whether or not we're going to preserve a structure to the premiums so that again, middle class people can continue to have themselves and their families insured. We met in Hartford with the exchange folks that run the system there, and again, they have examples all across eastern Connecticut. A family of 4 in Groton with an annual income of $130,000 will see their premiums increase by $13,885 a year. An Enfield couple in their 50s that makes $90,000 a year, their premium is going to go from $638 a month to $2,200 a month. That's $7,000 a premium per year to $26,000 per year. In Hebron, same thing. A couple in their 60s that's paying roughly about $700 or $800 a month is going to see their premiums jump to over $30,000.
Yeah, I think we're in that same boat.
That really is the issue. If we're going to have truly a continuing resolution that continues spending, as according to the status quo, and we got to make sure that people are going to be protected. And as you point out, the enrollment window opens up on November 1st, so we are literally weeks away. And when we met with the folks in Hartford who run the system, again, they're frantic in terms of trying to make sure that they get the information out, because the enrollment period goes pretty quickly, and the first billing for premiums goes out in December, because there's a lot of talk in Washington by some of the leadership, particularly in the House, that this issue can wait till the end of December or January. It's not central to continuing the government and keeping it open. But the fact of the matter is it really can't wait, given the fact that we've got this very tight timeline, and it's not like this is a big surprise. This is something that the exchange in Connecticut and healthcare.gov has been waving the flags for months now, warning people that because insurance premiums went up across the board in this country, and Connecticut's no exception in terms of the premium increases, which you mentioned in your question. The fact of the matter is the harm is going to be very widespread. A couple days ago, one of my colleagues from Georgia, her two kids got their notification that their premiums are going to double starting in January, and she sent out a tweet, just berating her own leadership for not disclosing when the big vote last summer on H.R. 1 was taking place that these types of premium increases were going to occur. Some of you may recognize her name. It's Marjorie Taylor Greene, who obviously is about as staunch a supporter of the president as there is in the House of Representatives. And she was calling on her leadership to extend the premium tax credits, just like you, Christine. So, this is not a partisan issue by any stretch. As I said, Marjorie Taylor Greene is about as true blue Republican.
I know who she is.
Yes,
I don't believe that they're going to renegotiate either. I don't believe that for a second. So.
Right. Well, again, it's the polling pressure is significant in terms of public opinion, and the Wall Street Journal reported on the fact that there's meetings in the White House now where they realize that there's actually going to be a real backlash if this issue doesn't get resolved along the lines that you suggested. So, again, I we'll stop there, and I really appreciate you taking the time to make the call, and hopefully we'll continue the discussion with other callers this evening.
All right, thank you. Thank you.
Thank you for your question, Christine. And as a reminder, everyone, to ask a question, please press *3 on your dial pad, and you'll be connected to one of our screeners. Next up, we will move on to Claire in Waterford. Claire, thank you for calling in. You are on the line with Congressman Courtney.
Hello, Congressman Courtney. Thank you for taking my call. My question has to do with, let me turn that off, with the turbines that were on the coast in Long Island Sound in New London, that were getting almost 80% done, and the money was pulled. They went to court, and now it looks like it's back on. But my question is that going to happen again, or do you think that's a secure project?
Well, thank you for asking about that. And you're correct that this is a project that, about a $4 or $5 billion investment by Revolution Wind, which is the developer, and went through 9 years of permitting, including getting sign-off by the U.S. Navy, U.S. Coast Guard, the Maritime Administration, FAA, you name it, in terms of all the different agencies of government to ensure that the placement of these wind turbines off the coast of Rhode Island were going to be safe. It's going to provide roughly about 750 megawatts of power, equally divided between the two states of Rhode Island and Connecticut. The work in terms of assembling the wind turbines takes place on State Pier in New London, and those are good jobs. The building trades, as you point out, have been hard at work, and 80% of the project was done. On August 22nd, the Department of Interior issued a halt work order out of the blue, and it went to court And in Washington, D.C., the district court judge, who was a Reagan appointee, issued a really forceful decision, basically lifting the halt work order. I spoke to, one of the members of the operating engineers union this afternoon, just to kind of catch up in terms of where things stand. Again, they're the crane operators at State Pier, and he said that, that the project is definitely underway again, that, the ships are transiting out into Long Island Sound and placing the towers, and the cables are being laid. It's not clear whether the Department of Interior is going to file an appeal at the circuit court in Washington, D.C. What the judge did, the Reagan appointee did, was actually refuse their request to stay his order, so that basically opened the door for the work to resume. I give him, tremendous credit for, just understanding how really ridiculous the halt work order is for something that the government approved and that was so far along. And, what we're just sort of tracking, with the developer as well as some of the workforce down there in terms of just what's the, what people are hearing out there in terms of, the possibility of more litigation. But again, this is a project which I think is going to provide a new source of energy for Connecticut, which is really important in terms of expanding supply, which is how you get to the heart of more affordable electricity for the state. And I appreciate you asking the question about it. Certainly, you can stay in touch with our office if you have any further questions, particularly if there's new news that breaks in the coming weeks.
Thank you for your question, Claire. Before we move on to the next question, I want to remind everyone that the best way to stay informed with Congressman Courtney's work and the latest news from Eastern Connecticut and Congress is to subscribe to the Congressman's weekly e-newsletter. To subscribe, visit courtney.house.gov/subscribe. Next up, we have Deborah calling in from Bledchard. Deborah, you are on with Congressman Courtney.
Yes, thank you, Representative Courtney, and thank you very much, Paul. My main question right now is when and how will you have Trump and his cronies be held liable for violating the Constitution? And I'm talking about freedom of speech, taking away our voting rights, wanting a third term. I could go on and on, but I'd like your thoughts on that, please.
Sure. So, there's no question that, in my opinion, the first term President Trump served, there was definitely some pretty contentious moments that are there. But there were people in his cabinet who really did, I think, exercise, some restraints in terms of, some of the directions that, were being talked about in terms of, different issues like deployment of troops in our cities, and which Secretary Esper intervened and General Milley intervened to, convince him not to do that. Obviously, it's a totally different scenario right now, and so there are every instance that we can possibly do in terms of trying to issue or put some guardrails around some of the actions that you described, and I agree with you in terms of many of those problems that we now are seeing, just unfold almost on a minute-by-minute basis, not just a daily basis. But to the prior caller asked about the halt work order, which did go to court. There was a successful judgment. The work has been resumed, but also in the House of Representatives, we fought out this issue just about, it was around September 8th or 9th. It was when we were doing the National Defense Bill, and a member of Congress from New Jersey tried to block the project as well. And myself, and I got some Republicans to team up in terms of blocking his effort. That's the key in terms of, the House of Representatives is trying to find ways to get common ground with some of his supporters. It's not easy. I'm not going to, because they're under a lot of pressure from the White House, so it's as I said, in that case, we were successful. We won the floor fight, and the amendment defeated, by a nice margin. And I'm, very pleased with the work that I did with some of my Republican colleagues. But there's other issues where, again, we have tried to put some, exercise of the legislative branch's checks and balances in place, and unfortunately, it's been pretty limited in terms of just having some success in that area there. So, we get a lot of questions in our office along the same lines that you asked, and certainly, we welcome that. There's as I said, this shutdown right now, and I mentioned earlier how the public opinion is very much in support of continuing healthcare subsidies. 8 in 10 Americans support the position of extending those tax credits, and obviously with those kinds of numbers, there's lots of Republicans and independents who think that people should get health care assistance, particularly middle-class people who don't qualify for Medicaid or too young for Medicare, and that's really kind of at the crux, as I said, of this impasse that we're in right now. So thank you for calling, and again, we welcome any other concerns or questions, because obviously the issue list goes on and on.
Thank you for your question, Deborah. Next up, we have an online question from Tanya. Tanya asks, do grants that provide funds for dementia and especially Alzheimer's research stop as a result of the shutdown?
So that's a good question. Unfortunately, what I would say is that starting really on January 21st, research projects that had been already approved and committed and obligated for R&D universities here in the state of Connecticut, whether it's the University of Connecticut or Yale University, were almost immediately suspended. And some of them were projects that extended into the areas that you talked about in terms of Alzheimer's, autism, obesity issues. The latest tally from UConn is about $43 million of research grants, again, have been suspended. And again, there's been efforts with NIH and some of the agencies, Department of Agriculture, that approved some of those grants to try and see if we can get them reinstated. But if anything, this trend of suspending grants with the shutdown, as you point out, has actually accelerated. We got notification from UConn that another grant in that area was suspended, and there's also some energy grants that UConn took a hit for. We also heard from some private entities that had gotten renewable energy and green energy grants suspended. One of them was up in Danielson, Connecticut, a really exciting new company that builds concrete with a different kind of recipe that does not generate as much carbon emission, but is resilient and has the bonding and strength and duration that equally matches traditional concrete and cement. They had a $6 million grant from the Department of Energy taken away from them. And again, that money was used to stimulate more private investment. They were hiring people out there. But again, this was something that they had jumped through all the hoops, been approved, papers signed, and then boom, they got this notification. So it's going to be probably a combined strategy of litigation and legislative pressure, just like the Revolution Wind project that I talked about in terms of trying to turn that around. But it's unfortunately the budget office just kind of views their authority in a very reckless fashion, that funds that have been approved by Congress and that actually have been obligated somehow are still subject to the whims of the budget director in terms of canceling it. And it's really an issue that's going to end up, I think, at the end of the day at the Supreme Court, because it's about the Article I powers of Congress. So I'll stop there, and thank you for asking that question.
Thank you for your question, Tonya. Next up, we have Michelle calling in from Enfield. Michelle, you are on with Congressman Courtney.
Hi, Congressman Courtney, and thank you for taking my call this evening. We appreciate you having these town halls. The question I have tonight is because I'm retired military and my husband's still serving active duty, and due to the fact that we have a government shutdown, and we've had these numerous over the years, he does not get paid on the 15th or on the 1st or et cetera, until we get paid. So it's kind of a two-part question. One, when do we see our government, obviously nobody has a crystal ball, trying to figure out how we can get this going, but also, why does our military keep getting used as pawns in these CRs every single year? That needs to be resolved, and I really think that's something that needs to be looked at in the future.
Well, thank you for asking that question. And actually, last week I was up at Bradley with the Connecticut Army National Guard, who were just really on the brink of doing a deployment over the Middle East. They're going to Jordan, Qatar, Saudi Arabia. It was about 500 Connecticut residents. So a lot of them were very young, and it was their first trip overseas. Pretty anxious and excited, and I got obviously a lot of questions about how secure is their pay, particularly for their families while they're overseas. And there is a bill which was introduced by Republican Jen Kiggins from Virginia, the Pay Our Troops Act, which I'm a co-sponsor of. There's a push to try and get Speaker Johnson to bring that to the floor as soon as possible. We should reconvene the House, certainly, so that business can be resumed in the floor of the House. And that would be the fastest, quickest way to make sure that people get paid. There is another sort of option that's out there, short of just reopening the government and getting all federal workers reinstated with their pay, which is that H.R. 1, which was the bill that President Trump signed into law on July 4th. The Department of Defense actually received some funding under the reconciliation bill. It was not for the purpose of pay necessarily, but that is something that the president can tap into in terms of possibly making the payroll on the 15th. So again, I'm going to push to get that legislation done. And as I said, it's a bipartisan bill. Congresswoman Kiggins serves on the Armed Services Committee with me, and she's also a member of the Sea Power subcommittee. So she's a Navy veteran. So we're going to try and push to see if we can get that avenue done. And I think all federal employees, but certainly particularly people wearing the uniform and those young Army guardsmen who are now serving overseas should be completely protected from the fallout from, in my opinion, totally avoidable shutdowns. And I think it's really important for families to speak up like you did, so I really appreciate you making the call this evening.
Thank you for your question, Michelle. Next up, we have Mark calling in from Enfield. Mark, you are on the line with Congressman Courtney.
Hello? Hello? Mark will call back. Let's go on to the next one, Ryan.
Sorry about that, Mark. Next up, we have Mark as well calling in from Stonington. Mark, you are on the line with Congressman Courtney.
Hi, Congressman Courtney. I very much appreciate you taking my call. First of all, from North Stonington rather than Stonington.
Okay.
There's a difference, as you know.
There is.
I very much appreciate you doing the honorable thing and declining payment when we've heard, earlier in this call, folks who really should be paid. That's an honorable thing, and it's very rare today to use the word honorable as applied to what's going on in Washington. So thank you very much for that. My question to you is, I understand the Democratic Party holding out for health care. My understanding is that in March, the Democratic Party voted for the CR that kept the government open. And in June, with the big, beautiful bill, that's what stripped out the health care coverage. And first of all, is that correct?
So,
am I correct in my understanding?
Yeah, so there was a CR that passed in March. Again, it was a partisan vote in the House, and Schumer agreed to, the passage of it in the Senate, which again got the government through the rest of the fiscal year. The premium tax credits were included in that bill. I mean, that's why people today, like the caller that we've heard, earlier today from Coventry, she is getting the benefit of those premium tax credits for calendar year 2025. The HR 1, if they had wanted to, they could have included the premium tax credit extension and for calendar year 2026. They chose not to, and the bill did a lot of other things on healthcare, which I very critical of, cutting Medicaid by $1 trillion, but that's a separate issue in terms of the premium tax credits. So again, we're in a situation today where, starting November 1st, people are going to start having to make decisions about enrolling in their health insurance for calendar year 2026. And, frankly, we could vote on a bill tonight and, just extend the premium tax credits that are on the books today into 2026, just like all the other, funding for the government is being extended for fiscal year 2026 in the CR. And boom, this issue would go away. It would be done. People would be able to enroll, with premiums that are not free. By the way, illegals can't use the program, which is something that you're hearing still to this day from people in the White House. The law prohibits individuals who are not citizens or lawfully present in this country from enrolling in the exchange. That's been on the books since 2010, and I'm happy to supply that language to anyone who is curious and wants to actually see it in black and white to show that whole claim is just a complete myth and a falsehood in some instances because it's been corrected so many times. But again, to the caller's question, the premium tax credits were protected in the continuing resolutions in the budget bills that passed through, that kept the government open through September 31st. The real question is just whether the funding is going to be there to extend those credits for calendar year 2026, and that's really where the impasse is centered around. How we doing, Ryan? Got another question?
We do. Thank you, Mark, for your question. Next up, we have Susan calling in from Mystic. Susan, you are on the line with Congressman Courtney.
Hi, Representative Courtney. Thank you so much for taking my question. My husband and I are seniors. Actually, we're over seniors. We're over the age of 75. And we basically live off of our Social Security check. And we have been eligible for the MSP, the Medicare Savings Program. My question to you is, due to all the craziness that's going on, for the year 2026, I am wondering if there will still be federal funding brought into Connecticut, since we are one of the blue states that Trump obviously does not care for. And will the MSP still exist, or will it be suspended?
Thank you for asking that question, because the MSP is a huge help to seniors in terms of paying their Medicare Part B premiums. I mean, for a lot of listeners who are familiar with the Medicare program, Part B requires that a payment be made to cover the services that B provides, and right now it's roughly, I think, about 185. It's getting close to $200 a month in terms of, the way it gets calculated by Center for Medicare Services on an annual basis. The MSP program, which is the Medicare Savings Program, is a program that actually covers the cost of those premiums, which is, obviously really is very important, particularly for families like yours, Susan, where, basically Social Security is your primary source of income in retirement. That's there. The MSP program is actually paid for by Medicaid, not Medicare, Medicaid, which is the program that's income-based in terms of people who are, on the lower income side get MSP paid for. And as you point out, Medicaid is paid jointly between the state of Connecticut and the federal government. It's 50-50. So moving forward, the question is whether or not the MSP program is going to stay exactly the way it's designed in Connecticut right now, which again, the state elects to use the maximum allowable opportunity for seniors in terms of what income levels get help. But there's going to be so much downward pressure on state governments with the Medicaid cuts that are coming starting in 2026 that that is something that a lot of patient advocacy groups that work with seniors are very, very much focused on in terms of whether or not the state is going to be feeling like they have to shrink the size of the MSP program in order to absorb so many of the other cuts that states are looking at. And I've been crisscrossing this district, meeting with Medicaid programs, whether it's Birth to Three, which is the program for families with severely disabled children that Medicaid pays for, all the way up to nursing homes, where most nursing homes, it's 2/3 of their patients are covered by Medicaid, and they are all definitely on a state of high alert in terms of the fact that they know taking $1 trillion out of the system, the Medicaid system, which is what HR 1 did, is really going to, as I said, put a lot of these programs under significant downward pressure. So I don't have an answer for you tonight, but it's a good question to ask, and it's something that people really need to stay on their toes and keep an eye on. As again, these cuts start to extend down to state government, and then they're going to have to make some really hard choices. So I'll stop there, Ryan.
Thank you for your question, Susan. Next, we have Stephanie calling in from Enfield. Stephanie, you are on with Congressman Courtney.
Oh, hey.
Hi, Stephanie. Hello.
Gus. Hello?
Yep, I can hear you. Go
My
ahead,
question
Stephanie.
is, what?
Hi. My husband's talking to you.
Oh, okay.
What is
sorry.
I just wanted to know, what is the difference between the two resolutions, between the Republican and the Democratic resolution? I already know the Republican side. I want to know the Democratic side.
The Democratic side extends the premium credits so that people who today are paying for their insurance through the healthcare exchange are not going to see their premiums go through the roof. And again, as I mentioned earlier, an Enfield couple in their 50s, age 50s, making $90,000 a year, are going to see their health insurance premiums increase from $7,000 a year to $26,000 a year unless we extend those credits. It's as simple as that. It's just math. And it's really, as I said, an issue which all the polling shows Republicans support extending those credits. And even Marjorie Taylor Greene, who, again, tweeted out, blasted out on her tweets, criticism of her leadership for not taking care of this problem because her two kids were going to be paying double their premiums in 2026 unless we extend those credits. I mean, that is really boiling it down to its simplest terms, and it's really a very easy issue to resolve. Other than that, it's really the Republican bill as written. We do, in my opinion, also need to make sure that there is absolutely ironclad assurance that all federal employees and military service members are going to get fully reimbursed for any lost paychecks that they may have incurred if this thing goes on beyond October 15th, which hopefully it won't. But that's it in a nutshell, and I really appreciate you posing the question, that's black and white, because I think that really helps crystallize, I think people's understanding of where the impasse is. And I'll stop there on Ryan.
Thank you for your question. Next up, we have Rosemary calling in from Norwich. Rosemary, you are on with Congressman Courtney.
Thank you. Congressman Courtney, thank you. Good evening, and thank you for taking my call.
Sure.
You've actually helped me in the past, and you've been wonderful. And thank you for your service. Thank you for the good and the bad and the ugly that you take. I appreciate that. And you've actually answered my question before I even ask it. So my question is there any way, is there some possible way that the way you're talking to us right now is the way that your fellow representatives could talk to the public when they speak on television? Because sometimes when I listen to Mr. Booker or Mr. Sherman, it's almost like they're talking in circles. I'd like to see more layman's terms. Like, for example, the woman from Coventry, which, God bless her, bring that to the public when you talk on television and say, listen, a family of four, or like you had also expressed it, a family of two making $90,000 a year, they were paying this amount, now they're going to pay that amount. So that people understand that, because sometimes it feels as though the politicians are talking in circles, and it's like, tell me what's going to happen. Tell me who it's going to affect. A family of four from Groton, Connecticut, they were paying $7,000 a year. Now they're going to pay $27,000. All we're trying to do is prevent them from having to pay that $27,000 a year. That's not what I'm hearing. Is there any possible way to do that? Any more possible way to maybe speak more in layman's term and let the people know exactly what it is? And like you said, simple as that. In a nutshell, all we want to make sure is that the premiums aren't outrageous.
Right.
That's my question. Is there any way to bring that to the party and say, listen, tell the people exactly, and for example, I do administer the MSP program through the state of Connecticut, and yes, we're there every day. We get phone calls. Just explain what the MSP program is to the average person who hasn't gotten to that age yet.
Thank you.
That's my question.
No, and how we convey information in terms of just like you said, really, dollars and cents, not with a lot of finger pointing or name calling or anything like that, but just really boiling it down so that people can understand what the out-of-pocket hit is going to be. And we're not talking about an insignificant number of people. In Connecticut, it's roughly about 170,000 people are on the exchange, and that some of that is family units out of that 170,000. So it's actually more people if you include dependents and children in that in that figure. And and I will share your critique with the powers that be in Washington, because unfortunately there's too much where people are really looking for clicks and how many likes and trying to just kind of get a response out of people, as opposed to really trying to just really like have a grown-up conversation about how do we fix a problem. And I think it's really as I said, when you listen to these stories in terms of families, which we've asked the exchange to give us specific examples, I think that that's really the best way to break through all the white noise. I mean, one thing I would just also share with people is that if we do not get this resolved by October 16th, then the actual bills are going to go out in the mail. Which I think people, again, you're talking about sticker shock. I mean, it's going to be, almost like a sticker heart attack when people see the jump in increase. And that's exactly what happened in the state of Georgia, with Congresswoman Marjorie Taylor Greene, because they sent their bills out actually earlier than Connecticut did. So her two kids, received the package in the mail that showed that their premiums are going to double, and talked to their mama, who, obviously, it's been reported all over the country, the tweets that she's been putting out about the fact that, no, we have to fix this. We have to avoid those types of increases. So thank you for your question, and Ryan, I'll stop there.
Thank you for your question, Rosemary. Next up, we have Norman calling in from Old Saybrook. Norman, you are on the air with Congressman Courtney.
Oh, hi, Congressman. I just have a question about the safety of air travel during government shutdown. I heard that during government shutdown, those air controllers are not paid. So if this is the situation, do we need to be concerned about the safety of air travel? Where is something like something bad may more likely going to happen?
Sure. Well, thank you, Norman, for asking that question. And actually, tomorrow I'm going to be meeting with the air traffic controllers who work at Bradley Field. That's the airport that I fly in and out of from Washington, and many other people listening are obviously very familiar with that. And the people who work, the air traffic controllers, and I've met with them numerous times in the past. They're an amazing group. A lot of them are ex-military and who put in incredibly long hours. There has been a staffing problem with the workforce all across the country in terms of air traffic controllers. The Wall Street Journal this morning, which is hardly a Democratic newspaper, did a really good story talking about the fact that we're probably about 4,000 short in terms of just the system as a whole. Again, there's about roughly 10 to 11,000 air traffic controllers that work all across the country. And this has been a problem which has been around for a number of years. I mean, sadly, that collision which took place in Washington, D.C. At Reagan Airport, where the American Airlines plane went down, there's no question that there was an issue in terms of manning that was in the tower. So the shutdown, obviously, at this point, no one has actually lost a paycheck yet. And again, there's a law in place which guarantees that when the government reopens, federal employees are going to be reimbursed. So they're going to be paid, but nonetheless, they don't need the stress of wondering whether or not their cash flow is going to be interrupted because a shutdown goes past October 15th. And but in terms of the overall problem of air safety that's out there right now, we have really got to redouble our efforts to expand the workforce. The last FAA authorization bill, Federal Aviation Administration authorization bill, actually authorized more spending in terms of hiring more people, so that we again have adequate people who are be able to have a real life, a normal schedule, and do their job safely. So I'm looking forward to meeting with these great public servants tomorrow, and it's one of the many reasons why we need to get this impasse resolved as quickly as possible. Again, I'll stop there.
Thank you for your question, Norman. Next up, we have a question online from Donna. Donna asks, what measures are in place to support your constituents in the event that this shutdown continues?
Well, thank you, Donna, for asking that question. So my office is fully staffed and is open both in Norwich and Enfield. And we are still fielding calls from constituents in terms of different issues and concerns. And I'm still out. As I mentioned, I'm going to be meeting tomorrow with the air traffic controllers. I've got a number of other community events and meetings that are happening out there. And just a couple days ago, met with the job training program that operates down at Grasso Tech for young adults. They just graduated their 5,000th graduate for metal trades, and are part of the this amazing hiring spree that's going on down at the shipyard. This morning I check every day in terms of what are the job openings, this morning there were 837 job openings in Groton at the shipyard at EB, and there's 579 over at Quonset Point for a total of 1,416. So that's still ongoing. And again, we're still working because some of is federally funded in terms of the job training that's going on. In terms of interacting with the agencies and departments, frankly, this shutdown has been different in terms of others in the past. Unfortunately, this is the fourth time I've been in Congress where there has been a shutdown. The VA is definitely open for business. If there's constituent issues, particularly regarding clinical care, we can help people in terms of trying to make sure they get help. Other agencies and other offices is very limited in this event that's going on right now in terms of our office's ability to get answers to questions across the board. And it's another reason why we need to get this impasse solved as quickly as possible so that whether or not somebody's got an issue with a Social Security check or whether there's an issue in terms of burial expenses for a veteran, to again more complex issues in terms of the State Department and other agencies of the government. So again, if people have questions, call Norwich, call Enfield. We still got a great team here that's working hard. Really proud of our staff that's has done a lot of work for a lot of people, and we're on standby to help people as much as possible. Ryan, I'll stop there. Maybe got one more possible question.
We do have time for one more. Next up, we have Joyce calling in from Niantic. Joyce, you are on the air with Congressman Courtney.
Good evening, Congressman Courtney. I'm very delighted that you're doing this town hall, and I receive your weekly email newsletter, and I'm grateful for it. My question is, it's not the theme of the evening, but it's vital to me and others like me. I am 79, and I have to work. Now, finding someone who wants to hire me is pretty darn hard, and so I'm grateful to where I am working as a substitute instructional assistant at an elementary school. However, that pays very little plus my Social Security. The Social Security goes 100% to rent. Simply because of my age, this will be my last year at the school because of the visual of what I look like compared to other employees, not my abilities. I'm energetic and able. Wish I did not have to work at this age, but I'm looking at less than a year where I will not have a home, but I'm scared, I'm terrified of Medicaid. And I can't get, I was hospitalized twice in the spring, and Medicaid allowed that to happen. All my doctors are specialists at this time in my life. I cannot afford to pay the copay. Out of the question, I would absolutely instantly have to give up doctors. And I know they waited till after the midterm in 2026 to put the axe down on the block about Medicaid. But what is it that's going to happen to people like me?
Well, thank you for your question, and it just breaks my heart for somebody who's given so much in your professional life to have to be sort of in a position of anxiety about something as I think basic and a given it should be in terms of making sure you're going to get all the medical help that you need. So as you point out, the full brunt of the $1 trillion cut to the program is going to kick in 2026. The Medicaid is the largest health plan in America. It's bigger than Medicare, which I think surprises people sometimes. But as I mentioned earlier on the call, it covers the full range of stages of life, from infant and toddlers, prenatal and all the way through to geriatric care. And the state administers the program in terms of just the scope of services, the rates that are paid to providers. It's funded 50-50 today by the federal government. One of the cuts that I know Governor Lamont and people in the state legislature are really anxious about is the potential for seeing that reimbursement reduce in terms of the federal share, and that's going to, as I mentioned earlier, going to put a lot of downward pressure in terms of the rate setting by the Department of Social Services, which runs Medicaid in Connecticut, as well as, again, whether it may affect scope of services. So right now, we do not have a totally clear picture in terms of how the state is going to try to manage this issue. They really are doing their best to try and project what resources they're going to have moving forward. The state's somewhat strong financial position right now, but if there's just no way that any state, including Connecticut, can possibly fill the hole that the cuts that were implemented in H.R. 1. And I think there's going to be blowback, just like there has been with this Affordable Care Act problem that we've been talking about this evening, because people really do, support the idea of people getting health care in this country. And again, it's very bipartisan. So I know that's not a very clear answer, but as I said, it's still a little bit early to sort of project outward. And I would just say that, certainly someone in your age, you're not going to have to go through any work requirements, because that's, one of the changes that's taking place. But that's for people, age 50 or less. Although God bless you, you're working far, longer than many other people do. But again, the real problem for the overall system is just the fact that the state, which is the funnel for how the program runs, is just going to be much more constrained as a result of the reduction that's coming from Washington. That can change. I mean, obviously, there's going to be hopefully intervening elections that could change the direction of that program. But at this point right now, it's still a process of trying to really crunch the numbers and get the best information possible. My office, and I'm sure all the state legislative offices in the area, are going to be on call to try and convey that information as accurately and quickly as possible. So thank you for calling, and I'll stop there.
Thank you, Joyce, and thank you to everyone who tuned in tonight and asked questions. I would now like to turn it over to you, Congressman Courtney, to provide closing remarks.
Yeah, thank you to everyone who listened in tonight. I mean, again, this is not my favorite topic certainly to be talking about in terms of the situation that we're in right now. But hopefully we at least made some progress as far as sharing some information about where things stand. Obviously, we're going to do everything we can to over-communicate to the district in terms of, how things are playing out. And, hopefully where, reasonable people are going to come together and work out a solution to this impasse. But again, I want to just make sure people know I'm committed to making sure that all the hardworking federal employees in the district are protected from taking any type of hit, particularly those wearing the uniform of this country. And we are, again, going to do our best to make sure that middle-class families and individuals who pay taxes are not going to see their health insurance go through the roof, which is really, again, the crux of the problem we're facing here this evening. Thank you for listening. And again, we welcome anyone who wants to call or write afterwards with further questions. And thank you, Ryan, for hosting.